Well, I'm sorry for my life, to be honest, because to me, yeah, the virus is a threat, but the lack of assistance is a real threat because when there's an outbreak in a long-term care facility, there's a breakdown in all the services, and now they're calling on the army to save people. So it's not a safe environment. What I want is to be able to get out of here with the assistance I need and manage my own care and be able to assure my own safety.
And what is preventing you from doing that? I would imagine money would be part of it, and having the staff and the people that you need to do that.
Yeah, well, the government is spending hundreds of thousands of dollars to keep me here in a long-term care facility. What I'm asking is part of that money to be able to hire my own assistant and manage my own care and choose the place I want to live. So that's something that can be done very quickly. I asked Premier Legault to order my release. Throughout the country, prisons are being asked to release some inmates. I think some people who live in long-term care facilities should have the option to get out with the support that they need.
The Minister of Public Safety, Bill Blair, has just tweeted that he will send in the army, the military, into Ontario to long-term care. There's been about 125 people deployed into Quebec. What does it tell us, Johnathan, about the state of long-term care inside Quebec, if that's where we're at, that's the kind of help that is needed?
Well, it's a total failure from the government to do anything, really. They had maybe a month to prepare, to do things. They didn't act. All they did was to prevent visitors. And then they went back on that as well, like a week ago. So to me, is that the whole idea that it's a good idea to force people to live in long-term care facilities is a dangerous proposition, and we need to have the choice and the right to live in the community in Canada. Often people are forced to live in those places.
You and I are the same age. You're 43, so you're a young guy with muscular dystrophy. How is your health in terms of making you vulnerable, in particular to COVID-19, beyond the fact that you're in the long-term care center?
Well, the virus, I don't want to catch it. I don't think anyone wants to catch it. In my case, if I catch it, they're gonna have to put me in ER, in ICU somewhere. It's gonna be very complicated because I use a tracheostomy, and my airway are exposed, so it's quite complicated. And as I said, the major threat is that I need 24-hour assistance. I always need someone not too close, not too far from me. So if there's not enough workers, for example, that's a direct threat to my life. And even now, they can't even provide me with the assistance I need inside this facility. I almost died many times in the last 10 years. And they're doing nothing for that. What I need is personal assistance. And it exists in Ontario, in BC, in Manitoba, in the US, in Europe. There's no reason why we can't have an alternative to institutionalization.
Yeah, and I know that's something you've been advocating for a long time, long before the pandemic, but obviously now the urgency is even greater for you. Are you, you're obviously a really strong person, but are you scared? Do you have moments where you're just very, very fearful in a way you haven't been before?
Yeah, it's lots of hopelessness, I'd say. I got nothing to look forward to. What's the plan? Even if I stay here and I ride this crisis and I come out alive, then what? I'm still here. I'm still condemned to live here the rest of my life. I want a future like everyone else. I want to contribute to Canadian society. I want to be able to work. I want to be able to live with my partner, but it's impossible in this place.